I think it's very important to educate the centers that radial artery catheterization, using that as a vascular access, is very easy technique, very easy to perform, and you can use it repeatedly, the same artery over and over. In some patients, we have used it even more than 200 times. Now, we do not use permanent central lines or permanent catheters or fistulas at our center because of the complications associated with these procedures. Now, for the venous access, the nurse applies the tourniquet proximal to the vein that we want to puncture. The area is cleaned. Once we can see visibly the vein, we inject a little bit of the local anesthetic. Here we inject about 1/4 cc or even less of the local anesthetic. 30 seconds later, we take an angiocath. For venous access, for the outflow, we use 16 gauge catheter, angiocatheter, and that is used to puncture the vein, and the catheter is gently introduced into the vein and the needle is removed. The access tubing side is attached to the catheter for the blood to come out. And usually with this venous access, we get a flow of about 80 to 90 cc's as well. At our center, we use the venous access as our first choice, but if we run into problems where we do not get a good blood flow, or if you have problems getting a 16 gauge catheter into the vein, then we use the radial artery for access. The important thing is to position the wrist so that the wrist is slightly hyperextended, and you can fill the radial artery quite well. What I do is I'm right-handed, so I fill the radial artery with my left index finger and the middle finger. Find where exactly the pulsations are best felt, and I take the local anesthetic and inject it just distal to my index finger where I feel the pulsations the best. And the local anesthetic is injected subcutaneously. About 1.5 cc's to 2 cc's of the local anesthetic is injected. We'll let the local anesthetic sit there for about 30 seconds, and then I will pick up the radial artery aero catheter, and usually I can tell how deep the artery is or how superficial the artery is based on how I feel the pulsations with my left index finger and the middle finger. I introduce the needle, I pierce the skin, and I advance the needle towards the pulsations. And as soon as the artery is punctured, I can see there's a gush of blood that I can see in the catheter. And as soon as I see that, I hold the needle very steadily with my left hand, and I advance the guide wire with my right hand into the radial artery. Once the radial artery is catheterized by the guide wire, then I slide the catheter over the guide wire into the artery and then take the guide wire out. And you can see the gush of blood coming out. And I know that the catheter is in the artery. And then I connect the access line to the catheter and anchor the catheter well with the tape. And we're ready to start. Usually we get a good flow. We go up to about 100 to 120 cc's a minute. Sometimes it's a little bit low, up to about 80 cc's a minute, but usually we get a very good flow above 80 cc's a minute. In order to perform therapeutic apheresis, it's important to get a good vascular access so that you can complete the treatment within about 2 hours, because the longer the patient stays on the machine, you can see some complications such as hypertension. And it's also important to get a good vascular access to run the treatment smoothly. After the treatment is done, we remove the catheter. Pressure is applied with gauze for about 2 minutes or so, depending upon how long it takes to stop the bleeding. Sometimes we apply ice bags over the site, which helps to stop the bleeding. And once we know that the bleeding has stopped, then we apply pressure bandage over it. And the patients usually go back to work after the treatment, or they can use the wrist. There is no problem. So Joseph, you've been getting these treatments for how long now?
Since 1994.
94?
Right.
Okay. And how many plasma treatments you have had?
I wouldn't know, but it's hard
Roughly?
to say. Oh, 200, 300.
Okay. So you've been, we estimate about 240 treatments.
240?
Right.
Okay.
So you've been getting it since 94. You were getting 3 times a week initially.
Yes.
And then gradually we decreased the frequency, and now you're getting how often?
Once every 2 weeks.
2 weeks, okay.
Yeah.
And we've been using the artery
Right.
as an access for all these years.
Every year.
Right. And have you had any problems with that?
Not at all.
No.
No.
Did it hurt?
No, not at all.
No? Okay. And after we take out the needle after your treatment, do you have any problems when you go home?
Not at all.
No. Okay.
No.
Have you ever had any problems with the bleeding all these years?
No.
No. Okay. Heather, you've been getting plasma treatments for how long now?
Probably 7 or 8 years now.
7, 8 years? Okay. And how many treatments you have had?
Oh, every 4 or 5 months
Oh,
for that.
I'm sorry, 4 or 5 weeks.
4 or 5 weeks,
Yeah.
yes, for that period.
And for about 5 to 6 years, you've been getting plasma treatments once a month.
Yes.
Right, okay. And we have been using your right wrist for the
Every
arterial access
Every time, yes.
every time.
Yes.
And you haven't had any problems?
No.
Okay.
No.
Was that painful?
No, it's not painful at all.
No, okay, good. All right. So we've been using this right wrist, right radial artery once a month for about 5 years now. 5 to 6 years actually, isn't it? Yeah, good. So, Helen, you've been getting plasma treatments for how long now?
2 years.
2 years now, and you had how many treatments?
This is the 39th.
39? Okay. And we've been using that site for the access,
Yes.
and you've been doing well, no problems with that? No, good. So, Michael, how many treatments you have had, plasma apheresis now?
Just about 100.
100 treatments? And that's been going on for how many years?
Approximately 9 years.
9 years? Okay. And we've been using this artery what's your frequency of the treatments now?
Depending on how well I'm doing, it could be anywhere between every 2 weeks to every 6 weeks.
So 2 to 6 weeks. And every time we do a treatment, we use the arterial line?
Yes.
And it's the same one?
Yes, same one.
Okay. And so we have done it 100 times and no problems?
No problems.
Okay. Was it painful?
No.
No, okay.
No.
Good. And after the treatment, we take it out and put some pressure, and you go home and you
home.
drive and everything?
Drive.
You go back to work?
Yes.
You go
I
back to work? Okay,
Play
good.
drums, play sports.
And it doesn't bother you, the site? No. Okay,
No.
good.